Fantastic. So friends, today we are having a super important conversation, one that I've been personally curious about for a long time. So I want to thank our guests from Central Square Theatre, the Huntington, and Gloucester Stage for being willing to jump in. We're going to talk about the questions that folks are asking as they start to think about reopening, but specifically in terms of their admin staff and the creative staff. I want to just preface this by saying that none of this is prescriptive. All of this is changing. We learn new things every day. New information comes out. So this is just a sort of like, this is what we're thinking. These are questions we're asking, stuff that we're considering to sort of help everybody else continue that thinking. If you have things that you are thinking about considering and want to put them in the chat, please do. Taneja is on the chat and will moderate questions. And yeah, we're going to take it from there. But thank you all for joining us. So first up is a dear friend and mentor, Kathy Carr-Kelly. Hello from Central Square Theatre. Welcome.
Hi there.
Hi there. Thank you so much for taking this on and going first. Thank you for volunteering as tribute. Let's start. I can start by going down the line of all the questions that I asked you, but if you have a sort of flow that you want to keep, what you feeling?
Sure. I'm happy to talk about the questions. I can just sort of roll with it. Hi to everyone. Good to see your faces, folks, or just your names, if that's what I'm seeing. I miss everyone. So Dawn's asked a bunch of questions about, what's our approach to getting administrative and production people back into our space. So we have had production people back in our space because we needed to strike the set that we were using so that we have a bunch of aerialists who are working in our space now, which I'm gonna put some pictures out one of these days about them. It's really cool. Such a fun thing to be doing if, there's 4 of them and they have a really cool rig. So it's safe and, useful for the space. So we were able to do a survey pretty much right away with our staff. So we have 10 people that are still on and have been on from the beginning. So that was helpful to us. We used a modification of the Harvard Business School survey, which I'm happy to share if anyone would like to see it. Happy to do that. The big thing was to figure out, are they comfortable coming back and what needs to be in place before they are comfortable. I'm glad that we did it because I was surprised. Some things were surprising, some things not as much. I will say some of the biggest things were, if we don't need to be in the building because we're not producing, then we'd rather not be in the building, which is very reasonable. I think for production staff, they wanted certain things in place. Our production manager, Cassie, was able to put in protocols right away. We have a Crush COVID handbook now where we have all of our protocols. One of the biggest issues, though, which we don't have any control over with people coming back, was staff being uncomfortable to use public transportation. So that's a toughie because, we don't control that. I totally get it. Over half of our staff use public transportation. So I'll leave that out there. If anyone's been thinking about that, if they have any great ideas around that, I'd love to hear them. Also, I think in terms of production work, there's been a push to be like, oh, for people with spaces, get in there and do that work you've needed to do. Now's the time. And, I felt that way for about 10 minutes. And then I realized, along with my production manager, that, this isn't really the time to bring groups of people together if we don't have to, even though you could get work done. So what's the work you can get done safely? And what's the work that will sit back until, some downtime in between shows a year or 2 from now. So that was a big understanding for us. Our protocol for overhire includes and actually for admin staff, taking your temperature as soon as you get into the building. There's a whole station. So you take your temp, you get a mask, you keep 6-foot distancing at all times. I'll say some of the things that are difficult with that is for production staff, if you're moving a set out and you have a piece that needs 2 people, but there's not it's not 6 feet long, then how do you do that? So we had to, Cassie had to figure out how to make that kind of stuff work, or in a way that people felt comfortable. In terms of where to start, I think for us, it's all about communicating really well. Are you comfortable? We're going to survey again in a couple weeks as we, when we feel like we're able to say, okay, this is what we feel like we can do next season. We'll survey again. So it's really about communicating, having protocols in place, accessible to everyone, and making sure people feel comfortable. One of the questions was where we've been getting advice from here. That's been super helpful. We have a relationship with MIT, so we get advice from them, and also from the ART Chan School. That was helpful. I feel like, luckily there's a lot of different advice out there, so we've been able to pull from all different places. In terms of costs of putting these protocols into place, I think the costs of like masks and sanitizer and cleaning, cleaning is the big cost. Cleaning more frequently is expensive. There's just no way around that. So that's a big cost. But they're all kind of small when you compare them to the trying to put on a show with your audience, social distancing 6 feet. That's the one that's down the road, but that's the big one that is the most worrisome. In terms of guidelines, have they changed our thinking? And I see Chris, you're on the call, and Jen, a bunch of other people who are with NEAT. So the executive, the entire NEAT folks met last week. The executive committee has been meeting with equity, regional, and district folks. And I think, and Chris, jump in and Jen, I think it's safe to say that we feel like the guidelines that the union has just put out are really broad. They're not specific. They're not a roadmap. They're certainly not adequate to make decisions based on. They're also totally out of our control. And they tend to bring up more questions than they do answers. So I think that's it. Did I cover them?
Yeah. There's one question that is in the chat box, Kathy. Kathy, when you say feel comfortable, are you getting information from those workers about what evidence/assurances they're looking for, or on what they're basing their decision making? And that's from Deborah Cash.
Yes. Hi, Deborah. Yeah, part of our survey was a list of, what would make you, what level of comfort you have with wearing masks, social distancing, so breaking, and then really breaking all those things down. So we did have that as a, that was sort of the first questions were, would these things make you feel more, how comfortable are you? Would these things make you feel more comfortable? I will say overall, our staff are not coming into the office at this point. If they do, they come in just for quick, like they follow the protocols, they get stuff they need, or they use, printer or something like that, and then they leave. So administrative staff, they just don't really want to come yet.
Great. Another follow-up question from Dawn. Kathy, can you share that survey and the protocols in the chat? Yes. And then a question from Kate Snodgrass. Can you speak about ventilation in the spaces? You have a newer building, so ...
Right. Yeah, that's a biggie, that our building isn't really old. But actually, I remember thinking, I think I asked this on the StageSource call, but thinking, oh, well, we have these great big vents, right, that are built to like cool a space really quickly. So that's got to be good. They were and the specialists were like, not really. So it's all about the amount of outside air you can bring in. So frankly, I can imagine that when we go back, we're already bringing in a lot more outside air, which means that air conditioning is not good. It's not going to be cool in our theater. Or even cold, which sometimes it is. If you bring in outside air, then you're bringing in whatever the temperature is, and that is the big. So the systems that most theaters have are larger, and that's useful to circulate air, but you got to be circulating the air from outside, and not just air conditioning, which, you know, cools the air and recycles it over and over again.
Awesome. One other question from Josh. Hi, did you get any feedback from the city on whether or not people were allowed in?
No, Josh. My friend, we did not. I mean, I think Cambridge is, you know, I follow Boston pretty much to try to figure out what we're doing. So not really. Cambridge is mostly following the state. They haven't put out any specific guidelines yet that I know of.
Great, Dawn, that's all the questions in the chat.
Excellent. Thank you, Kathy. If you can stay on the line, please do. Friends, as other questions come up, please feel free to put those in the chat. Right, I'm seeing, sorry, something from Peter. Wow, I still haven't gotten used to working on Zoom. Cambridge has a daily clean that ups the weekly clean that Boston and the state have put out. So I think what that is that their requirement is that buildings must be cleaned daily. Right. Versus weekly, and what that money is, I cannot imagine right now.
It's a lot.
It's a lot. It's a lot. Is that whoa? Great. 200 a day, Peter says, for them. And if you all know the dance complex building, that it is not a small building by any means. I think my question then for all of the Cambridge folks on this call, is that a mandate or is that a suggestion? Is that a thing that...
So Peter, you may feel you have a better sense of that. I mean, I did see that come out, and you know, I have questions about professional cleaning service, not professional. I have a lot of questions around that. So
the way it's stated is professional clean for common public areas, and it doesn't differentiate. But that's where it differentiates from the state, whereas you can do a light clean every day in office areas at the end of every day, and the state, and I believe Boston, and then it starts to, the city says professionally cleaned. So not that I want to put anybody in danger, of course, but it's on my list of questions, of course, to go back to the city with and say, this is what this really means to us. And do you really mean that? Or what else can we do that's just as safe and do that? But right now I have a finance person who won't budge on the budget because she sees the word, this is what's required, right? So.
Right. I wonder if the city of Cambridge has plans to sort of help subsidize that, if there's something that they are thinking about. Right? They laugh ruefully. I think
we'll be pushing back on that some, and hopefully getting some wiggle room. Again, I'm not sure they're not always thinking about, like we know, right? Not always thinking about entertainment venues and what does that mean for us.
And what does that actually mean? I know a lot of people are talking about the ways that people can collaborate and share expenses and costs. And I think as things like this come up, I wonder if this is mandated in Cambridge, if it comes down in Boston, are these things that maybe companies can go in on and share the costs with, sort of hire one company that like manages all the theaters. But that's a question for another day. I am going to move us back into, well, I would say Boston, but Adam, you guys are actually out in Everett.
We are, but we have buildings in Boston as well.
So hi, everybody. This is Adam Godbout of the Huntington Theater's production wing, going to talk to us about some of the stuff that they are asking questions on. And T, I did not say this, but I've given Adam permission to do a screen share, so.
Great.
So
hit it.
Oh, it says host has disabled participant screen sharing.
Oh, shit. Oh, sorry.
Anyway, so while you're fixing that, us, like Central Square, we had some work to do, striking the shows that we had up on our stages. Just in, like everyone else, we just got up and left. We took the approach of just, like everyone else. Oh, there we go. I can get you. There we go. You guys should see the screen now. Great. So we took the approach, we just went right through the state guidelines and the city guidelines, and picked out if something was stricter in the city, then we put that right into our plan, and just stuck with that. So Everett didn't have any specific guidelines, which was nice. So we just worked with Boston and the state of Massachusetts. So what we did is I worked with Katie, who is also on this call, and we really just had a group of people that came together, and we felt strongly about overachieving all of the guidelines that were put forth. So some of the things that we did is we created a COVID officer, which is stated in the Boston plan that you need to have a particular person. And we created a primary and a backup COVID officer for every single one of our spaces. Somebody to go to ask questions, somebody who's in charge of that space to make sure that that space is ready to go. We felt it was really important to have somebody that was really part of that space that you were working in be available. We also did survey our staff. We did it less formally and just contacted them. And I will say about the public transportation, I do have staff members that are taking public transportation every day, and they actually reported back to me that they feel very comfortable with what the T is doing. They were very nervous at first to take the T, and now feel much better about the T in general, and they see the cleaning that is happening on the trains and feel comfortable about it. So that's good. So what we did is we created this slideshow that I'm showing you guys now. Part of the deal with this COVID is you have to do a training. So we made a PowerPoint so that all of the staff was trained on exactly what they needed to do. More training happened in spaces. And the way we broke it down is you can see these are the guidelines issued by the state of Massachusetts, literally listed out. And then in the next slide, we then showed our employees what we're going to do. So everyone has to have no fever, 100 or higher. I believe the regulation was actually 100.4. We dropped it down to 100 degrees just to account for varying things. Flu-like symptoms, shortness of breath, everything that everyone is used to. We issued a mandatory quarantine for people who were diagnosed, came into contact, had symptoms, or traveled out of state for if they traveled out of a state that they didn't live or work in. Some of our employees live in New Hampshire or Maine or Vermont. And then again, training was huge on our part. So we wanted to let our employees know what they needed to do if they felt ill. Leave work. If they're suddenly ill at work, leave work instantly. Go home. Then contact your supervisor. Things like that, just to make sure that people really understood that their health and everyone else's health is more important than any of the work that we were doing, and to not feel bad. The social distancing guidelines. We took those guidelines provided from the state and from Massachusetts. For the state, we followed the manufacturing guidelines, as we're only opening our offices now, but we were coming in to do the strike work, and we felt that it was closer to manufacturing than we felt it was closer to the construction. Construction seemed like it was a much more overarching large corporation situation that we are not in. So some of the things that we're doing for social distancing, we have staggered start times. People they come in, they have to check themselves into, right now they get checked in by their supervisor into our contract tracing form. And people are expected to stay 6 feet away, wear a mask 100% of the time. We are staggering breaks and lunches so that people aren't congregating in those small spaces at any time. Going forward, starting tomorrow, actually in our building in the production center, I used Google Forms for this contract tracing, and the staff are actually going to start to check themselves in self-report if they have any sort of illness or fever, and they'll have a station much like Central Square Theater does. And we also instituted, you'll see some new signage on the next sheet. This is your distance, and then this is our check-in. So these two signs are on every single one of our doors that you come into the building, which is good. Allows people to do things themselves. We've issued maximum occupancy signs all throughout the buildings to make sure that people don't congregate in areas and that they realize, okay, this room is only good for 2 people. So if I walk by the room and there's already 2 people in that room, I keep walking and I find a new room to go to eat my lunch. It just allows, it takes all the guesswork out of it for the employees in general. Oh, it's gone. I can't use that room. I can't sit there and I don't have to worry about if I'm 6 feet away. I can't. The next thing we did, we wanted to minimize the amount of work that we were doing at the end of a day. We committed to sanitizing the building every day at the end of a work call. So we dedicate right now an hour for every one of our staff members to help sanitize the building as we leave every day. We all feel that this is a really great way to make sure we're preventing the spread of this disease. But we wanted to minimize that. So rooms that we don't go into very often, we've done a flip sign. One side says sanitized and one side said compromised. And it's very simple. I just used those fancy double stick things with the hook, punched a hole in the card, and people just flip it over. And it's been working flawlessly. So if somebody goes into a room, they flip it over to compromised, and at the end of the day, we go back and we sanitize that room. And if it still says sanitized, we move on with our day. Massachusetts issued some hygiene protocols, and we followed that up as well. So we have instituted that employees will frequently wash their hands and stated when they are going to wash those hands. We've also provided signages, just like everyone else in the world, I'm sure, on how to wash your hands, and provided a bunch of hand sanitizer when we're not near sinks. So employees will be required to wash their hands and sanitize them many, many times during the day. So the biggest thing to prevent, the spread through touch is to actually just wash the hands of people. It minimizes the contact dramatically. So we issued mandatory hand washing. I don't know if anyone else has a problem with their production department being a little dirty sometimes and rough around the edges. So this one we actually are really keeping after, and I'm actually going around and making sure that people are doing this hand washing. Sometimes they eat lunch without washing their hands. So hygiene protocols, as well as that, the guidelines state that you need to clean common areas once a day. I guess in Cambridge, everything once a day. But so we decided that we're going to do this a minimum of 2 times per day. So, and you have to keep a record of it. So we have records in our bathrooms and in kitchens. Anywhere that we had common areas, we made a sign for it. We hang it up and we track throughout the week who cleaned it and when we cleaned it. I don't know how long we have to keep those for. It is very unclear in the guidelines from the state. But it is something that we're doing, and it definitely makes our employees feel a little bit better. Like I said, we polled them earlier before we started hiring them and figured out what their complications were and how they felt about it. And I polled them every day. I asked them as they come into work every day how they're feeling, what's going on. And it really helps. I think it's making them feel a lot at ease, and they feel good about what we're doing. And I think one of the biggest things for us is we're involving them in the sanitization process. Sorry for the siren. And that is making them feel better that it's not happening behind the scenes where they can't see what's happening. They're actually watching and doing the sanitizing, and they feel much better about all of us working together to do that. And I thought that was an interesting take. So once a day at the end of the day, we in the production center have created kits for every one of our staff. So instead of just having common tools that people come and grab, they have their assigned screw gun and they're assigned this and they're assigned that. But there's still tools that are shared. And what we're doing, they're pulling the tools out of the tool room. And then when they're done with them for the day, I have an 8-foot folding table on the outside of the tool room. And the tools don't go back in the tool room, they go on the folding table. And we do a heavy sanitize of those tools at the end of the day. Then the first thing we do in the morning is we go ahead and we put them right back into the tool room. So tool kits, work tables are all labeled and assigned to certain individuals. So anything that's on your work table is yours. No one else comes over, no one else touches it. I realize that a lot of places probably can't have that sort of luxury in space, but it's something that we were able to do and we felt was good. As Kathy said earlier, constant outside airflow is great. We don't have air conditioning, sadly, but also good. So we just open our giant dock doors and we turn on our exhaust fans. And that's just going all day long to circulate our air. And something that Kathy brought up about strike, when you're striking, sometimes you are closer. And so we do have some N95 masks for those people who are being asked to be a little bit closer than 6 feet. And if they want to use those, they can, other than the cloth or the throwaway disposables. And that seems to make people feel a little bit more comfortable too. So that's kind of my slideshow. I see a lot of blinky lights, so there might be some questions.
Hey, so all the questions actually in the chat have been answered by Katie Most. Thank you, Katie Most. We see you and value you. So there are actually no outstanding questions right now. Done.
Thank you, Katie.
Oh, one from Kate Snodgrass. Can you send these guidelines to us? Yes, I'm guessing you can, but also just so everyone knows, this video will be available. It will be on StageSource's YouTube and also on the website. So I can send you links to the video as soon as we're done here today.
Great. Sorry, I'm seeing one question that I think came in from, oh Lord, moving so fast, from Pat Gaybridge. How has compliance been so far? The system seems great, but are people complying?
Really, yes, everyone is complying well. We're doing some spot checks, and we, everyone wants to keep, we're a pretty good family, and so everyone actually really wants to try hard to make sure everyone stays really healthy, and I think that that's really important too. So, but everything seems to be going well.
Okay. There's a second question. Have you had anyone at any site actually show symptoms and then leave immediately as intended?
No, no one has showed
symptoms. And Chris asked about tracking the costs of this. Is that, sorry, Katie, I see you nodding your head.
The question is, have you been tracking the increased cost of all the efforts? Katie says, is a great resource for all. So yeah, Chris Griffith's question is, have you been tracking the increased cost of all these efforts, period?
We are tracking costs right now, barring materials costs. The labor cost is we're down about 20 to 25% efficiency on our day, easily. I would say strikes, we hovered right around 50% efficiency of where we normally were. So.
Great. All right, friends. Adam, thank you. Katie, thank you. Temple, thank you all for this. Stay on the line as long as you can. If folks have questions, you know what to do. So now I'd like to move on to our friends out at Gloucester Stage. We have Chris Griffiths and Bob Walsh. Guys, if you can unmute yourselves. Excellent.
Hi, folks.
Hey, friends. Thanks for taking the time. So, starting off, what are the questions you guys are asking yourselves?
So many questions, right? There's been so much development. I feel like for us, it went from no one knew what to do, no one knew anything for so long, and then all at the same time we got regulations from the governor, the city, the equity from STC. It all started coming, and it's now our job to digest all of those pieces and become experts so quickly. So I don't know if recognize that for everybody else in the room, if you've also had to be reading 70 million of these, oh, here's the 4 things you need to do before you can open. We feel that on a deep level. It's also different for us. We live in Gloucester. So Gloucester is a small town, but it's also a town that's definitely on the older part of the spectrum. Rockport, I think the average age is literally 79. So you can imagine that this part of the community is very careful about moving forward. And I think just thinking about what's been shared today is just so great so far. For us at Gloucester Stage, we're unique in that our 2020 season is physically is out the door. We're not we can't meet this year because we produce from June to October. But we also offer unique challenges because typically we close a show on a Sunday matinee, and then we open the next show that Friday. So we have actors in the space on Tuesday at 1 o'clock. We literally have a ton of people on top of each other running around, making everything happen so quickly. And we're kind of asking ourselves, hey, that's not going to be able to work anymore. How can we move forward in a safe way? One thing we're also doing right now is we're in the middle of a restroom renovation. So we're moving towards ADA compliance. For those of you that also live in old buildings, our theater used to be a car dealership built in the 1930s. So not quite built for major airflow. But, we're kind of like recognizing those challenges. But as we've been fixing the bathrooms, still now during this safe period, we've had one person in at a time, doing the plumbing, one person in for the dry, one person in, and so that concept of thinking about how, strike and how production can be separated by, these entities with support, that is something that we're thinking about. I mean, we live and produce all within our building, so we don't have a separate shop somewhere else. But it does, every week in the summertime when we're not producing it's $15,000 out the door in revenue. So to add costs, to add time, and to lose money in a year like that Catherine Carkello was talking about is like, and we might not even have a full house to sell seats to. That is a scary budget that does not work. So it's asking those questions now for us as we're looking to 2021. But it's great to see all these policies that are already in place. So smart. I think another thing too, Bob, will jump in whenever, but we also have been thinking in the interim, this is a little off subject, but in the interim, as we've been developing digital content, like we're also asking ourselves, how can we re-engage our designers and production team on these small black box projects that are being filmed at their houses or that are happening, because we own our space, we have a couple of single artists coming in to film when literally no one's around. How can we still bring a lighting designer in to help set that performance up for success, bring a sound designer in, do that separately, and then have them in for some parts on Zoom, some parts in the space to be working on our board and our instruments, so we can still be sending them financial support in this year when they're out in the cold like we all are too. So that's feedback that we've gotten from the people that keep coming back each year, as we've checked in on them. So I don't know if anyone else has thoughts on that or have been thinking about that in this sort of digital time period. But
we have a question from Darren that says, Chris, since you're doing a summer season, have you thought at all about doing an outdoor performances / events?
That's a good question. Yeah, we are working towards that. Again, being in Gloucester is actually a benefit for this, right? It's a little bit smaller. I can text the mayor and keep her in the loop of what we're thinking. Yeah, we have a large park on the ocean that we're trying to think through what that looks like. The cost for that is, probably around $20,000. But with the community's help, and I think making it free, making it family focused, and making it this sort of gift that we as a theater can provide for the community in that moment is I think the prime directive. So if we can find a way to pay artists, to continue supporting designers in some way, and then providing this moment for the community to gather distantly with literally chalking out safety squares in the grass, that's something we're working towards. But I think the biggest question, on everyone's plate, is can we even get people together in the rehearsal room for that to then perform it in the end of August if we did that? So, we're putting a lot of things into motion for that performance specifically. A big community-wide performance outdoors up here, but then we have a lot of emergency ripcords on that. I'm sure everyone else has been installing more safety exits on all their projects. But thanks for asking.
I think for me, that question, those sort of two dueling questions, a lot of folks are talking about producing outdoors. But right, Chris, the idea that that still is going to cost $20,000 and how are you making money on that? I don't know if there's anybody who is already thinking that and what that kind of budgeting looks like. But if you have thoughts on it, I'd love to see that in the chat. It is a potential for a further conversation. But then the other question of rehearsing and how are you, I don't know if anybody is even to that point yet. If you're looking at producing outdoors, yes, then that question is coming up. And then how do you rehearse? Where do you rehearse? So if anybody is tackling those questions already, please put something in the chat or message us offline. Again, further conversation as people sort of try to figure out, will audiences come back? Do people want to be outside? Do they want to be indoors? What does that look like? I think there is value in that. For Chris and Robert, I'm wondering, where do you begin, right? Your timeline is now sort of pushed to next season. So what are the first things you are looking at tackling? Or can you even say?
Having a positive outlook that we can even produce in 2021. That's probably my single biggest hurdle. Mm-hmm. Trying to have imagination around, particularly you talk about the ventilation, the cost of ventilating this room in the appropriate way was prohibitive. There's just I'm really in a place where I'm having to, I don't know, I suppose think insanely outside the box on how we might do this. So thank God, I couldn't be more grateful to Chris that he is brainstorming things, but it feels like there's this make do time, and there's stuff that we can do to engage ourselves creatively, and then there's how do we really produce in the way that we're accustomed to. And I think that's the work that I think it's gonna, each month you're sort of waiting to see what's going to happen next, and it feels as though it's not getting better before it gets worse. So trying to figure it out.
Great.
Yeah. Sorry to be such a downer about it, but
no, I mean, I think now is the time, right? We've all been in this managing crisis mode. We've all been kind of Muppet arms, but right, there is also the real fallout, and that none of this is easy. And that we're facing some really tough and hard questions, especially with the idea that many folks may not be able to produce until the fall or winter, right? What are you doing? One of the things that I am encouraged by, I think that idea that you all are talking about, how do we keep the designers engaged right now? How are we finding opportunities for folks and creatively thinking outside of the box, so that there is a possibility or a chance that we can get to that next season. I think that's a lot of what these conversations, I hope, inspire. How are we able to do that?
Well, I loved, the concept that Adam was talking about having this sort of COVID, liaison for each of their spaces. That does make a lot of sense to me. One thing that I was thinking about is, like, as all of us have had to become such experts on this so quickly, and none of us really have I don't have a degree in this, unless someone does, and then by all means, please don't take offense. But it is like, how can we work together with, like, normally our production manager is the person who's in charge of safety here. We have one space, so it's smaller, but we're like, all right, do your thing, don't break any rules, please, and then we rely on that person to do that. So now in this moment, we're just trying to be, not leaving anyone in the dust, literally, physically, and figuratively, in that, like, having that conversation as a group to try and create these resources. And so then everyone feels empowered, and it's not like on anyone's back to be responsible for, this didn't get cleaned or something like that. I think it's important, like, that's sort of the buy-in from all of your staff from start to finish, someone that can make the selection to stay at home today. We actually, what's funny about Gloucester Stage is, our office that's getting redone is like all big countertops. No one has their own space because we go from a staff of like 6 in the off season to a staff of like 24. So everyone needs to be able to pop up, throw their laptop down. And we've also been working on breaking the barriers down between our admin staff and our artists as well, so that they feel connected on all ways. And now we're like, nope, build that wall back up. No, like how can you still maintain that community that we're building while we're here, but also like make space? And so I think by empowering all of your staff to like figure out, hey, when does a work from home day make more sense than being in the office is so powerful.
T, do we have any questions in the chat?
No, there are no questions right now. There's just a lot of people speaking about outdoor events. So I would say look at the chat for that. Bryn has said that Comp Shakes is likely to have more to say in a few weeks or so as they've been talking about it. Pat Gaybridge has some cool ideas for their season coming up. And yeah, more conversation about ventilation.
Right. I cannot tell you how many times I have asked people about ventilation, their HVAC system, in the last, 2 weeks. I don't know if anybody who was on the city call with Boston last Friday, and the ART calls with the city and with StageSource and whomever else, that is the new thing. I have become an expert in it, and I don't know what the hell it is, which is not true. I do have some idea, but still. So friends, if there are no more questions, I'm gonna call it for today. And 15 minutes of found time for everyone. Thank you so much for joining. This was incredibly helpful, incredibly thoughtful. I appreciate everybody also just sharing, this is where we are, right? This is hard stuff. We are not in a good place. It is helpful to know that so that we can all help each other and be a resource. So, the thing that I should say, if you heard something, if you tapped into something, connect with each other. You have each other's email. And if you don't, you have mine. I can get it. You have T's, you have Gina's. You can connect. Super easy. Thanks, friends. Have a good one.